So now, when it comes to disaster recovery planning, every airport management, they have something that we call disaster recovery plan. They have it on ground. Just in case the electricity just suddenly shuts down or went down, there is an alternative. And that alternative must come up within there is a time frame for it. They have a time frame for it, just to make sure that the lag time is not too much. For some airports, within 30 minutes, for some within 10 minutes, within 20 minutes. Every airport has their own policy. I'm just using airport as an example, just to give you an idea. So they make sure that they minimize the downtime and data loss. Why? Because while all this is happening, data is going. Many things is going astray. So they have to be very, very fast. Number two, ensure quick restoration of operations. When you have a good recovery plan on ground, you can easily make sure that everybody goes back to what they are doing before. You can easily make sure that operations kickstart as soon as possible. It won't be that something happened and for the next 2-3 days, everything is just shut down. It shouldn't have to be like that. And same thing to healthcare. I've had experiences of bomb threats. I've had experiences of bomb threats whereby, like, a whole hospital, very big hospital, they have a someone that came in to plant a bomb, and automatically everything is disrupted. No service. Meanwhile, surgery is going on. We have transplants going on. We have other things going on. Then how do we manage all of that? So these are some of the reasons why we need disaster recovery planning. It helps us to make sure everything is well managed. Another thing is it protects life, property, and sensitive information. And also, another reason why, the purpose of DRP is to meet regulatory requirements. We're still going to talk about that later in this presentation. And also to foster organizational resilience. Every organization must have gone through one thing or the other. And each time they go through all those risk or unwanted events, they must learn from it, they must adapt to it, and then they must put those lessons into practice. They must put in structures or infrastructure to make sure that if this thing happens again, we can manage it better. And that is how they build resilience. Now, what are the benefits of DRP? It reduces recovery time and financial losses. It helps to improve organization resilience. It enhances trust with stakeholders. Now, for this one, let me ask a question now. Among all the banks in Nigeria, which one do you think you trust more, or you trust most? You like their service more?
Zenith Bank.
Zenith Bank. Now, for those that say Zenith Bank, if you ask them, if I go a bit further now and I ask you why Zenith, I'm sure you will give me answers like, well, their network problem, even if they have network problem, they resolve it on time. Probably they have a good customer care. You can easily call them. You can resolve whatever issues you have and stuff like that. So these are some of the things that help you to build trust with stakeholders and things like that. And also legal and regulatory compliance. Do you know that if you are a manager, let's say a clinic manager, you are managing a big hospital, and something happened along the way, probably there is a natural disaster or maybe an armed robbery event takes place. And then along the way, some of the data, your patient data or information, somebody say Zenith Bank, okay, well, it's personal. So let's say along the way, some of your patient's data got lost or probably it's exposed. Maybe some of your patients, let's say you have a celebrity among one of your patients, and along the way, some of their information finally got leaked out. Do you know you can be sued? They can sue you and you pay big money. Trust me, big money. They can be sued. So these are another reason why we need to have disaster recovery planning in place, because it also helps us with legal and regulatory compliance. And lastly, it helps to increase staff confidence during crisis. Moving forward, we need to talk about the core component of a disaster recovery plan. The core component. Every hospital have their own disaster recovery plan. Every hospital, I mean, every good, functional, serious, I mean, people that really meant business, they have their own disaster recovery plan. But when you check it, you will notice that all these components, they are represented. Number one is risk assessment and BIA. That BIA, we are going to talk about it. Simply talks about business analysis. We'll talk about it. So risk assessment and BIA, that is, it helps to identify potential risk and evaluate the effect of systems interruptions. That's number one. Number two is recovery strategies. Method to restore IT infrastructure, data, and services. Data and services. Number three is disaster recovery team. There is a team because when something happens, everybody knows what they need to do. It's not like, okay, let's say in an hospital, there is a cardiac arrest. Let's say maybe 3 or 4 or 5 patients, they are having cardiac arrest at the same time. So everybody will not be panicking. What do I need to do? What do I do? You all know what to do because why? You are part of a disaster recovery team and you have been trained. You know what you need to do. Everybody knows what they need to do. You know who to look up to. Okay, this is our leader. This is so the person can easily delegate. You go there, you go there, you go there, you need to do this, and then everything go smoothly. So disaster recovery team. And then another thing, communication plan. You see on this one, I'm going to talk a bit more on this. Communication plan. Why? Because during disaster, every communication process can be affected. So at that point in time, most of the time, you cannot trust the words of mouth, like what people are saying. So what do we do? Say, they said we should do this. A serious organization, they must have a communication plan at hand. Let me give you an example. So recently, we had a bomb threat in one of our hospitals. And it happens that all the staff there, they were panicking. People were panicking. What do we need to do? Like, no information. People don't know who to trust because everybody is saying different things. So in that kind of situation, a serious organization, they must have a communication plan. For my hospital, what they do is they send a mail because everybody has their own official work email address. So they send a mail and they communicate, they keep us updated through the mail. So it's not like you are waiting for your boss to tell you something. Why? Because even your boss might not have. Hold on. Some of the examples should have international focus because some of us connecting. Okay. All right. So why? Because you cannot trust what people are just saying randomly. You need to get the real information. What is the organization? What are they saying? How do we go from here? How do we go from here? Like something happened, what should we do? They can tell you, okay, you know what? We need all the people to move from this wing to that wing, like from this building to this building. How would you know? There's no way you will know, but if they can, I'm just using an email as an example. If everybody have the access to the email, like their own work ID address, and then can easily send the message to everybody at once, they all know that we need to go to this wing. So that is the communication plan. For some other organization, either IT, healthcare, any other organization, they might have their own other means of communication. I'm only using email as an example. Then another thing is data backup and storage. Data backup and storage. I'm very sure that we are aware that most organizations now, they are now moving from paper-based documentation to computer-based documentation. That is, instead of you writing on paper, all those paper stuff, writing on paper, the information you need to put on paper and everything, you put everything on the system or on the computer now. So it really helps. Why? Because it's easier to save. It's easier to have a backup for those informations that you are putting in compared to just paper-based. Those ones can get burnt. Water problems can happen and everything gets soaked. So these are just some of the examples. And now for the storage part, we have what we call the cloud-based system and things like that. We are still going to talk about it later on. And also we have what we call recovery procedures. that is step-by-step guides for systems and data recovery. These ones are for IT professionals. And lastly, testing and maintenance. Testing and maintenance, that is regular drills and updates to ensure plan effectiveness. I think the example I will give concerning this, I don't know if you have been privileged to be to one of these fire stations, all those fire station officials. One thing you will notice about them is they do quite a lot of trainings. They do simulations, a lot of drills. Now, all these things they are doing, it helps them to be better equipped, to gain confidence in managing, unpreventive, in managing events that happens that they really need to come in. So it helps them to know what to look out for. It helps to build their effectiveness. It helps to build their confidence, and also it also helps them to check for things they need to watch out for and things like that. So these are the core components of a disaster recovery plan. Now, the other time I was talking about BIA, so this is what we're talking about. So business impact analysis. It's also part of the risk assessment. Risk assessment and BIA, they are together. So I'm just going to talk about it briefly and then we'll move on. So business impact analysis is a systematic process that is used to identify and evaluate the potential effect of an interruption due to a critical business operations due to disaster, accident, or emergencies. It helps organizations understand which functions are essential and the impact of their disruption over time. So business impact analysis, it helps an organization, so to say, to understand the impact, how something can really impact their operations during disaster, and also to know, okay, which of this function, like in everything we do as an organization, which one are the essential services that we must make sure that by all means, this one is functioning. Let me give you an example. If you all remember during COVID lockdown, I'm sure you remember that word essential worker. They say, oh, I'm an essential worker. They ask everybody to stay in their house. However, they only allow essential workers to be moving about. They are the only ones that go to work, transport, some go with their cars and things like that. So they are the only ones that are permitted to come out of their house. Why? Because they call them essential worker. The word essential simply means that if anything will not be functioning, this one must be functioning. Why? Because they are very critical to survival. So now, the objectives of BIA: identify critical business functions and processes. They also help to determine the recovery timeframes for essential functions and essential functions. Another thing is it helps to estimate the impact of functional disruptions. And lastly, it guides the development of recovery strategies and priorities. It will help you to guide the strategies and the priorities. Why? Because you've already, you know what you are looking at, you know what your goal is, you have already done your assessment and your analysis. So it's really important. Now, why BIA matters in healthcare? Because at some point you might be like, business impact analysis, what does that one have to do with healthcare? It really has a lot to do. It ensures that vital services are not interrupted. Have you ever noticed that when you go to a big hospital, even if every other department is not working well, the A&E, accident and emergency, they're always functioning 24/7. I mean, I'm talking about a standard hospital. They're always functioning. Why? Because vital services must not be interrupted no matter what. Another thing is it helps to protect patient lives and sensitive health data.
Somewhere.
Oh, okay. Another thing is it prevents regulatory violations, reduces financial losses from system downtime, and it promotes proactive risk management culture. That is, we are all proactive. We don't have to wait for something to happen before we know what to do. By the time we do our own analysis as an healthcare organization, we know that there is a risk here, there is a risk here, there is a risk here. So we're already putting some things in place to make sure that the risk will not take place. The risk the potential will not even come to place at all. And paraventure, hello, sorry. Hold on. Sorry, everyone. I just need to check something, please. Hello. Hello, everyone.
Hello, sir.
Yeah, sorry for the
We are here.
Yeah.
We are here. Continue.
Okay, sorry for the interruption. So, like I said, it helps to promote proactive risk management culture. That is, we have to make sure that we have everything in place. Once we've done our risk identification and risk assessment, we have to make sure that even if the risk that we've identified eventually happens, to a large extent, we've been able to curb or manage it to a large extent. So it won't be something that will meet us unaware and we just give everything to chance. That's that. So moving on. So what are the key, like I said, key components of business impact analysis? Number one, identify critical functions. We need to determine which operations are essential to keep the organization running. For instance, patient diagnostics in a hospital, the billing systems, IT systems. Then diagnostics simply talks about lab, the laboratory unit. Because if you are taking blood samples and you take it to the lab and the lab is not functioning or they have a problem there, the whole hospital is on standstill. Is on standstill because we can't move forward. The doctors cannot do anything. They have to wait for the result before they can make any rational decision. Okay, this is what we need to do. They can't. So as an hospital, they have to identify the critical components, which operations are very essential. Now, the next thing is determine dependencies. That is, you have to identify systems, personnel, vendors, or technologies required for each critical functions, including both internal and external dependencies. So what this point is simply talking about is, earlier I made mention of laboratory units. Those laboratory units, they cannot function except they have some things they need. Let me give an example. Let's say I'm still going to use an hospital now. Let's say the hospital is having water problems, like water supply is having problem. Even the lab cannot function. Meanwhile, the lab is an essential, very essential unit, but they depend on water. They depend on the water. So if the water is not forthcoming or something is wrong with the water, they can't work. If they can't work, it affects the whole. So they are all intertwined together. So we need to identify critical functions, and we also need to determine dependencies. What do they need to function? Those essential units, what do they need? So we have to identify those things. Another thing is assess the impact of disruptions. You also have to assess for the impact of disruption. That is, you analyze the consequences of functions such as disruption of time, including financial losses, legal, regulatory consequences, customer and patient dissatisfaction, health safety risk, and reputational damage. You see that word, reputational damage, is a big thing too. Reputational damage. Reputation is powerful. If anything happens to it, it might take you years to come back to your feet. So you have to take care of it. And then another one is you have to define your recovery objectives. When something happens, what are the objectives you need to do? You need to get in place as quick as possible. So here I have established recovery time objectives, that is how fast a function must be restored, and recovery point objective, how much is acceptable. That is just an example. How much data loss is acceptable. For some people, let's say something happened in an hospital, their medical condition, if all those things are leaked outside, it's a big problem. So we have to determine how much can be tolerated and how much we can't even tolerate at all. And lastly, we have to prioritize functions. We have to prioritize function. That is, we have to rank criticality of each function based on impact and recovery needs to determine which should be addressed first in disaster recovery. That is, which of them should be addressed first in disaster recovery. So moving forward, we are rounding up very soon. So what are the disaster recovery strategies and framework that we can put in place? Number one is minimize interruptions to normal operations. To a large extent, we have to minimize interruptions to normal operations. We have to limit the extent of disruption and damage. Limit the extent of disruption and damage, minimize economic impact. We have to establish alternative means of operations. We have to establish alternative means of operations. Another one is we have to train personnel with emergency procedures. You have to train your team. If you're working with a team, you have to train them, let them know what to do or how to go about it when it comes to an emergency situation. And lastly, you have to provide a smooth and rapid restoration of service. These are the strategies you must have in mind. That is the objectives that must guide your strategies that you must have in mind. And still on disaster recovery strategies. So still on that, we have data backup strategies. You have to work on that. Redundant systems. This one has more of IT intonations, but yes, I have to put it there. Redundant systems, the cloud-based recovery. We have the recovery sites, virtualization